Okay. Thank you for waiting. I know it's been a little while, but we're very busy upstairs and I had to finish rounding on a few patients before I could make it down here. How are you feeling? Okay. So for starters, can I just get you to tell me your name and date of birth? Good. And do you know where you are? Excellent. Okay, so you are post-neural chip implantation surgery. Congratulations. And due to that, we are going to be running some diagnostic tests to make sure that none of your cognitive functions are affected or that there aren't any physical side effects. Okay? Okay. To begin with, I am going to need to examine the surgical site, possibly change your bandage. So, there's two. Okay, so let's take a look here. Are you experiencing any sort of pain or discomfort? Okay. How about any itching, burning? Okay. And how would you say your emotional state has been? Have you experienced any kind of symptoms of anxiety or depression? Okay, good. Well, there's a little bit of redness, but nothing that is concerning. That's normal with the healing process. Looks like the incision has closed nicely. So I'll get you a new bandage here. Go through here. I have a checklist. So, okay, no discomfort at the surgical site. How about any nausea or vomiting? Dizziness, loss of consciousness, fainting? Okay. And you said with depression and anxiety? Okay. Any sort of hallucinations? Tremor? Okay. Speaking of mental health, we do offer a subscription service called SmileLink. So if at any point you're feeling anxious or depressed, just focus on the smiling icon in your mind, and the app will send targeted jolts of electricity to different areas of your brain to stimulate a synapse response. And what that will do is create an instant surge of dopamine, causing you to feel better. If that is something you are interested in, then make sure that you stop at the front desk on your way out, okay? It's $19.99 a month, but patients find it to be absolutely worth it. So, okay. So, real quick here. Okay. And I also need to let you know that while you're here, we will be running hourly diagnostics, so you can expect to be here for the next 6 hours, just to make sure that there's no unwanted side effects and that everything stays stable. Okay? Stable. Okay. So then we will be keeping you here for the next 6 hours to run hourly diagnostics. We want to make sure that your brain stays stable. We don't want any kind of brain melting. No, really. So, okay. Right now, I'm going to do some temperature checks, okay? I'm going to start with your ears, because we need to make sure that there are no kinds of warm or cold spots here. So, just pulling the ear back. That side is within normal range. So now I'm going to check the other side as well. Okay, you're in normal range on that side as well. So that's good. If at any point you start feeling any kind of increased warmth in the ear canal, I want you to let us know, okay? Now we're going to be looking for any sort of hot spots here. Oops, I hit the button. Everything seems to be in normal range. Okay. So now we're going to examine inside of your ears to make sure that there is no presence of any leakage or unwanted neural tissue in the ear canal. Try to relax, okay? I'm not seeing any sort of drainage or leakage into the meatus here. Tympanic membrane to be running a series of diagnostic tests with you, okay? Before we begin, I'm going to be placing a sensor on your finger that will be keeping track of your heart rate, okay? And looks like we have some tape left on here. Okay. So then this is just going to go clip on your finger, just like so, okay? Yep, we can use that one. Alright. And what that's going to be doing, is monitoring for any sort of elevated heart rate or unnatural emotional responses. So, that is it. Okay. Actually, start my program over here. Alright. So, are you able to identify this object? Okay. And does it trigger any sort of emotional response for you? Okay. How about this one? Can you identify the color? And how about the type of flower? How about this one? Okay, can you be more specific? It's a button. Can you identify the color of the button? Okay. How about this one? Okay. Is it evoking any sort of emotional response for you? Anger. Okay. Good. Good. What is this shape? And does it trigger any sort of emotional response? Sadness. Yes, okay, good. What is this object? And what is the color? Okay. And any sort of emotional response? Apathy. Okay. What color is this? Okay. Any sort of emotional reaction in response to the color blue? Anger again. Okay. Good. Making sure I didn't. One more. What is this object? And does this object trigger an emotional response for you? Anger again. Okay. Excellent. Well, you did very well on the flashcards. Now we're going to be running a diagnostic on your ability to adjust your sensory input, okay? So to start, I want you to focus on how brightly or how dimly you see the room, okay? And to make it brighter, I want you to think brighter, okay? Okay. And how about dimmer? Okay. And then think in your mind of what level of light was in the room before, and let's return to that. Okay. So then I want you to do the same thing, only this time I want you to think about color saturation. So in your mind, focus and increase the saturation levels. and then make them less vibrant, more dull. And return to baseline. So now one more. We're actually able to adjust the audio, so think in your mind about turning the volume down. Okay. Okay, and then turning the volume up. It's stuck. How about now? Okay. Look at my light, okay? Has the volume returned back to normal? Okay. Looks like there are a few bugs in regard to the volume control. So I'm going to do a quick manual reset here just to make sure. Alright. So stay very, very still for me, okay? So once again, focus in your mind on turning down the volume. So it should be quieter. And then focus on turning the volume up. Okay. Alright. So now we also have one more thing we need to test, which is your night vision. So I want you to focus in your mind about seeing in the dark, okay? Okay. And then back to normal. Now, I'm going to be rechecking your ears to make sure that didn't cause any sort of overheating. So, starting on this side. Good. And the other. Alright. I'm going to keep this covered for now. And again, I'm going to check your ears to rule out any sort of brain melt. So, any tenderness or discomfort with me pulling the ear back. Okay. Still don't see any kind of drainage or materials inside of the ear. Still no sign of redness or swelling. Check the other side. Any tenderness or discomfort on this side when I pull the ear back? Okay, good. And I don't see any drainage or foreign materials in this ear either. No sign of erythema or inflammation here. So far, you're looking stable. So now we're going to do some neurological testing here. First, we're going to test your sensory abilities around your face, okay? So, just using my little hammer here. Okay. Good. Checking your joints. Okay. And other side. Try to keep your eyes open, okay? I apologize if this is a bit bright. Just making sure. See a good reflection in the eye here. Alright. Keep your eyes open for me. Okay. Focus on my finger right here. Keep focusing. Now focus on that one. Okay. Good. Keep your head totally still. Okay. I want you to follow the light with your eyes, not turning your head. Okay. Okay. Now I want you to close your eyes, okay? And behind your closed lid, tell me when you see my light. Okay. Good. Okay. You can relax. Go ahead and open your eyes. behind me right here is a vision test, okay? Or a vision chart, rather. So first, can you identify this letter? This one. And this one. What is the lowest line that you're able to see? Can you read it for me? Okay. So now this line underneath it, are you able to see this? I want you to focus on that line and think magnify. Okay? And now we're going to do the same thing with this bottom line here. Think magnify. Good. Can you identify this color here? And is it the same or different as this one? And what color is this? Focus on my finger, and what number do you see in your peripheral? Okay. Focus. What number? Okay. Focus on my finger right here, and what number? Okay. And does that number elicit any sort of emotional response? Anger again. Okay, good. So then, focus on my finger here, and what number? Okay. And any kind of emotional response? Still anger. Okay. I want you to focus on the number 3, and it's gonna look like I'm gonna poke you in the eye. Don't look at my finger, look at the number 3. Okay. Focus on the number 2. Okay. Now, do you see the pattern of squares on the back of this card? What number did you see? Focus on the squares. What number did you see? Squares. Okay. Squares. Good. Now, focus on my light. Focus on my light here. Okay. Focus on my light. And again, focus. Okay. Now, I want you to focus on my finger right here and tell me when you see my light enter your peripheral vision. Focus on this finger. Okay. All right. Look at my left finger, not my right. Look at my top finger, not the bottom. Left. Top. Right. Okay. through. Going to check once again for any sign of overheating. So I'm going to use my ear thermometer here. Good. And then this side, let's check. All right. Going to look inside your ears again. Okay, how about at this point? Is there any tenderness or discomfort inside the ear? Okay. Still no sign of any kind of fluid or foreign materials inside of the ear canal. And I'm not seeing any redness or induration. Check this side. Okay. Yep. This side looks the same. No fluid or drainage or foreign material in the ear. And any pain or tenderness on this side. Okay. Good. Okay. So then we're going to do one more test here, okay? So I'm going to be whispering a number in your ear, and I want you to tell me which number you heard, okay? So, 46. Okay. 62. Okay. And any emotional response to the number 62? Nothing? Are you sure? We'll come back to that. Okay. 78. 91. Okay. 27. Okay. 18. Okay. 62. And how about now? Any emotional response? Anger. Good. Good, okay. Alright. 6. Good. Okay. And 29. Okay. Good. Okay. So now we are going to just sit quietly for a few moments. I'm going to observe you in an idle state and see if there's any sort of responses or emotional reactions or anything that we need to recalibrate, okay? Okay. It looks like everything is in working order. I'm not seeing any sort of symptoms that we would need to address or would require us to replace the implant, so that's good. So we are going to keep you here, like I said, for the next 6 hours, and we will be running an hourly diagnostic. It will not be as in-depth as this one, but we need to make sure that there's no sort of sign of overheating or, I guess we could just say, misplaced neural tissue. Okay? So, right there is a call button sitting on that table, okay? If you start experiencing any intense warmth, any chills, feelings of flushing, nausea, loss of consciousness, you probably won't be able to press the button, but if you feel like you might faint, any sort of strong ideations to design and develop an automobile based on children's drawings, seizure, any sort of hallucinations, colors in your vision, then I want you to press that button and someone will come in here right away, okay? Okay. And in case I am not the physician who follows up with you in the next hour, please don't forget to ask our front desk about SmileLink, okay? They sponsor this program and we are eternally grateful to them. Alright, you just sit tight, okay?